notice what's the first thing we say to someone who's acting a little bit different than the norm? पागल.
सबको मालूम है तेरा स्क्रू ढीला है.
I'm so confused by this term. जब कोई कहता है ना आप पागलों के डॉक्टर हो, आपके पास पागल आते हैं. Once somebody said मैं आपकी ओपीडी में नहीं आना चाहता हूँ. I said क्यों? वहाँ सब पागल लोग बैठे रहे. आपका डेफिनेशन क्या है पागल का? जैसे मूवी में दिखाते हैं. तो ऐसे तो अगर आप आएंगे तो what does that imply? He said तो I will be counted as that. So इतना स्टिग्मा है ये वर्ड लेकर because
Dr. Dutta. She is neuropsychotherapist and renowned TEDx speaker, specializing in helping people manage mental health issues such as depression, anxiety, and loneliness.
depression is loosely used. It's actually major depressive disorder. Minimum 15 दिन. For most of the time, you have low mood, a constant fatigue feeling despite getting enough rest. Along with that, guilt, lack of concentration, too much or too little sleep, appetite issues, self-esteem issues. I'm not good enough. I'm useless. I'm worthless. I'm hopeless.
आपकी इंस्टाग्राम पे मैंने एक बहुत इंटरेस्टिंग चीज़ देखी थी, साइकोलॉजिकल टूल किट.
आपको इमोशनली रेजिलिएंट रहने के लिए यू नीड टू फाइंड वेज. ये 5-6 पिलर्स मैं अपने कंट्रोल में रखना चाहूँगा इन अ गुड वे. नंबर 1 इज
On World Mental Health Awareness Day, Traya Health, along with Dr. Dutta, will be decoding and breaking the stigma around mental health, educating us on how loneliness and trauma impact our brains.
lonely people have higher chances of mental health issues. Trauma is very complex. It does affect your brain. So, something traumatic that may have happened with you will stay back in your body, maybe in aches and pains, emotions, flashbacks, memories of traumatic experiences like natural disaster, rape, yeah, even something as traumatic as a very bad breakup or being physically hurt, domestic abuse. All of these get stored in your brain. Sleep is the presentation for a lot of mental health issues. तो मैं कहती हूँ sleep is the tip of the iceberg. जब भी कोई sleep issues लाता है, इसके नीचे क्या है? What's underneath the sleep issue? And then you open a Pandora's box and you see this much.
डॉक्टर एरा, यू आर अ साइकियाट्रिस्ट एंड आज हम सब कुछ अराउंड मेंटल हेल्थ डिस्कस करने वाले हैं. लाइक यू सेड, आई थिंक उसको और भी एक लेवल ऊपर जाते अराउंड माइंड डिस्कस करने वाले हैं. ये एक ऐसी स्पेस है जहाँ आई कांट इवन टेल यू कितने मिथ्स है, कितने मिसअंडरस्टैंडिंग्स है, और मतलब ये एक ऐसा कॉन्वर्जेशन है जो व्हाट द हेल्थ को करना ही था. सो आई एम सो ग्लैड दैट यू आर हियर एंड वी आर गोइंग टू हैव दिस चैट टुडे.
Thank you for having me.
आई थिंक आई वांट टू स्टार्ट विद दिस फर्स्ट थिंग कि किसको जाना चाहिए टू एन एक्सपर्ट, क्योंकि लोग समझते हैं कि जो पागल है ये पागलों के डॉक्टर होते हैं, साइकियाट्रिस्ट.
We call that a lot.
So that's like the first thing I want to understand. The second thing I want to understand is psychiatrist, therapist, psychologist, neurologist, कब किसके लिए जाना चाहिए और ये experts कौन हैं? Let's start with that.
Excellent. So, if you have an eye, तो आपके आंख के डॉक्टर कभी कभी लग सकते हैं. Obviously not every day. If you have a bone, you may need a orthopedic. If you have teeth, you may need a dentist. If you have a mind, you may need a mental health expert. So as simple as that. अगर mind है तो definitely mental health issues हो ही सकते हैं. अब इतने सारे terms हैं. This is the first problem. पहले ही mental health के बारे में awareness नहीं है. दूसरा, जाएं तो किसके पास जाएं? डेंटिस्ट पता है दांत का डॉक्टर होता है, ऑर्थोपेडिक पता है हड्डी का डॉक्टर होता है. ये टर्म्स ने हमें काफ़ी कंफ्यूज कर रखा है. सो लेट मी स्टार्ट ऑफ बाय सेइंग साइकाइट्रिस्ट्स एंड साइकोलॉजिस्ट्स आर ब्रदर्स एंड सिस्टर्स. तो हमें साइकाइट्रिस्ट वर्सेस साइकोलॉजिस्ट खेलना बंद करना है. वी आर साइकाइट्रिस्ट्स विद साइकोलॉजिस्ट्स. वी आर टीम्स. I will talk separately about neurologists, life coaches and other ists in a while. So let me tell you, psychiatrist और psychologist में फ़र्क क्या होता है? Because brother sister हैं तो कुछ तो differences होंगे, right? They stand for the same cause. That is mental health, awareness and well-being of people. Their methods may be 19-20 different. क्योंकि लोग यही कहते हैं कि अरे psychiatrist के पास मत जाओ, psychologist के पास चले जाओ. सो लेट्स अंडरस्टैंड, साइकाइट्रिस्ट मेडिकल डॉक्टर्स होते हैं, जैसे आपके ऑर्थोपेडिक, जैसे आपके डर्मेटोलॉजिस्ट, जैसे आपके गायनोकोलॉजिस्ट. सो हम 5.5 साल MBBS, 3 साल MD, फेलोशिप्स. ड्यूरिंग दिस ट्रेनिंग वी लर्न टू ट्रीट, डायग्नोज, डू थेरेपी. येस, वेरी मच. दैट्स अ वेरी बिग मिथ. लोगों को लगता है साइकाइट्रिस्ट थेरेपी नहीं करते हैं. Some choose not to. Their OPD may be very busy, they may not want to, but they can do the entire jing bang of the mental health. ठीक है. अब आता है साइकोलॉजिस्ट की बात. साइकोलॉजिस्ट 2 मेन बाइफर्केशन टाइप के होते हैं, क्लिनिकल एंड काउंसलिंग. बोथ आर एक्सेलेंट, बोथ आर इंपॉर्टेंट, बट क्लिनिकल साइकोलॉजिस्ट आर ऑलमोस्ट akin to a psychiatrist role, minus, yes, they cannot prescribe, and they do not know the medical intricacies of the body. So वो diagnosis कर पाएंगे, वो therapy दे पाएंगे, वो plan बना पाएंगे, but they will not be able to understand अगर diabetes की वजह से comorbid कोई condition अगर आ रहा है. Counseling psychologists are the biggest helping hand for us because they will provide the therapy that is needed. And Saloni, the unsung heroes are actually psychiatric social workers and nurses, psychiatric nurses. कोई इनका नाम नहीं लेता है. ये इतने important हैं. They go work in the periphery, they work on the wards. These are important people as well. अब बात आती है neurologist की. Actually, psychiatry ना neurologist का बच्चा है. We are an offshoot of neurology. So once upon a time, neurologists and psychiatry, even Germany में आज तक आपको psychiatry और neurology दोनों की डिग्री मिलती है. So that's why a lot of psychiatrists in India also call themselves neuropsychiatrist. This is another question people ask me. Are neuropsychiatrists different than psychiatrists? They're not. अब लास्ट में मैं बात करना चाहूंगी लाइफ कोचेस की. Have you heard the popular term?
Yeah.
Unfortunately, life coaches are not mental health experts. I'm going to say it once, I'm going to say it twice. Let me get some hate for it, but that is the reality. They are people like you and me who decide to get a certification in a particular thing, maybe life coaching, maybe business coaching, maybe child parenting, maybe career, maybe, for that matter, any particular niche. And they are coaches. But these are certifications. There is nobody to uphold them to a certain standard. Sadly, बहुत सारे mental health problem वाले लोग इनके पास जाते हैं. Ideally, they should be referring them to the right experts. But लोगों को ये term softer लगता है, इसलिए वहाँ पे फ्लॉग करना आसान हो जाता है. सो थेरेपिस्ट कौन है, ये एक लास्ट पार्ट रह गया. साइकाइट्रिस्ट, साइकोलॉजिस्ट दोनों ही थेरेपिस्ट हैं. थेरेपिस्ट इज एनीबडी हु प्रोवाइड्स थेरेपी. काउंसलर क्या है? काउंसलर इज अनदर टर्म इन इंडिया that is particularly reserved to interchangeably use with therapist. नहीं है interchangeable, but we like to use it because again, counselor बोलना, career counselor भी होते हैं, school counselors होते हैं for that matter. हमारे school बच्चों के schools में, right? Marriage counselors होते हैं. नहीं, marriage counselors usually therapists होते हैं. So there you go. The term is very easy to accept. यार मैं counselor के पास जा रहा हूँ, school counselor के पास भेजा है. Their methods are different surely, but again, those are only for people in this field who can understand the difference. Now the final question. आप किसके पास सबसे पहले जाएंगे?
I think नीचे से शुरू करेंगे लोग generally. So therapist या psychologist probably.
तो साइकियाट्रिस्ट कितने स्कैरी है ना.
And then if the psychologist say कि हाँ सच्ची में तकलीफ है and refers to a psychiatrist, then I'm guessing.
Sure. I appreciate that. I tell people go wherever, start wherever. इंडिया में इतने साइकाइट्रिस्ट एंड साइकोलॉजिस्ट हैं ही नहीं, और इतनी हमें अवेयरनेस ही नहीं है कि मुझे पता हो कि मुझे किसके पास जाना है, राइट? सो स्टार्ट एनीवेयर. दैट्स माय हम्बल एडवाइस टू पीपल. स्टॉप प्लेइंग साइकाइट्रिस्ट वर्सेस साइकोलॉजिस्ट.
जो मिला जाओ.
स्टार्ट. अच्छा साइकोलॉजिस्ट आपको साइकाइट्रिस्ट के पास भेजेगा अगर जरूरत है, अच्छा साइकाइट्रिस्ट आपको साइकोलॉजिस्ट के पास भेजेगा अगर जरूरत है. तो सिंपल.
ओके, सो आई अंडरस्टैंड नाउ. एक फॉलो अप क्वेश्चन. व्हाट इज थेरेपी? Your definition of therapy, because I'm sure I want to know if मैं जो सोच रही हूँ therapy is that right.
आप क्या सोच रहे हो पहले ये समझते हैं. What's on your mind?
So on my mind is that of whatever techniques that are available for a mental health well-being can be divided in 2 parts: medications, and everything that's apart from medications can be put in the bucket of therapy, which could be different techniques.
Very close. 19-20, honestly.
Okay.
So there's pharmacotherapy and there's psychotherapy. Pharmacotherapy is medication. You're absolutely on point. And psychotherapy, उसमें भी बहुत सारे types के हैं. So just like if you go to a physiotherapist, there are many kinds of therapies that a physiotherapist does. वैसे ही psychologists and therapists and psychiatrists have many therapies under their umbrella. There is a third part that people don't talk enough about is the newer development that has happened in medical science is the non-invasive brain stimulation. जिसमें कि आप brain को stimulate करके depression, tobacco addiction, OCD, इन सब चीज़ों को relieve कर सकते हैं. And that does not involve anything invasive. Brain में छेद नहीं करने की ज़रूरत. So it is non-invasive. That's another part of therapy that people don't know about.
Interesting. अब चलते मेरा जो सेकंड क्वेश्चन था. नाउ वी अंडरस्टैंड द एक्सपर्ट्स, वी अंडरस्टैंड कि बहुत कॉम्प्लिकेटेड नहीं है, जहाँ जो मिल रहा है जाओ, लेट्स स्टार्ट. किससे जाना चाहिए? क्या मुझे पागल बनना पड़ेगा टू गो टू अ मेंटल हेल्थ एक्सपर्ट? एंड व्हाट इज पागल?
I have never met a pagal in my life. Been working for 13 years. I'm so confused by this term. जब कोई कहता है ना आप पागलों के डॉक्टर हो, आपके पास पागल आते हैं. It's very interesting. Once somebody said, मैं आपकी OPD में नहीं आना चाहता हूँ, आपके क्लिनिक में नहीं आना चाहता हूँ. I said क्यों? वहाँ सब पागल लोग बैठे रहेंगे. तो I said wait, आपका डेफिनेशन क्या है पागल का? जैसे मूवी में दिखाते हैं, जैसे डिशेल्व लोग रोड्स पे मूव करते हैं. तो ऐसे तो अगर आप आएंगे तो what does that imply? He said तो I will be counted as that. So इतना स्टिग्मा है ये वर्ड लेकर. Because notice what's the first thing we say to someone who's acting a little bit different than the norm? Pagal. I have never met a pagal person. Please feel free to tell me if you know one. We are all humans. हमारे बहुत सारे emotions होते हैं. कुछ emotions हमें disturb करते हैं, कुछ emotions दूसरे को disturb करते हैं. हमारे behaviors कभी कभी लोगों को अटपटे लग सकते हैं. If that is what you mean, then maybe that term can be justified. But in my humble opinion, I treat human beings with a mind to be the best version of what they can be. जो भी उनके लिए वो definition हो. Whether to be the best mother, whether to be the best parent, teacher, doctor, friend, partner, doesn't matter. So that is what I treat.
So are you saying that अगर मुझे किसी भी area of life में improve होना है, better बनना है, I can also approach therapy?
Absolutely.
I don't have to be sad, depressed, crying, or have a certain mental health problem to actually go to a mental health expert.
Absolutely on point. You do not need to have a disorder to speak with the expert. आप आए हैं तो मुफ्त की दवाई या मुफ्त की थेरेपी खा के जाना पड़ेगा is not compulsory. Maybe the person will themselves say, देखिए, we'll talk about this for a couple of sessions, but I think you'll be good to go. शादी की example ले लेते हैं. One of the most common challenges we see people is postpartum and शादी. Two things जिनके लिए कोई किताब नहीं लिखी हुई है. And it's a transition period. Another common one would be young ones going to college. ये 3 life adjustment phases हैं. You know, your first college, you're away from home, it's so scary. When you get married, there's so much adjustment. When you have a baby, there's no textbook for the mother or the father for that matter. These adjustment phases, we call them adjustment disorder by the way. नाम ही adjustment disorder है. Are beautiful phases to work with a psychiatrist, therapist, psychologist, doesn't matter whom, to just go through those phases. It starts, it stops, you're done, go back, doesn't matter. That is actually a bulk of my practice if you ask me.
That's wonderful. I think अगर आप afford कर सकते तो why not? Why struggle through and then हमेशा मुझे मेरा पर्सनल ये रहा है कि लोग हाइंडसाइट में रियलाइज करते हैं कि मुझे हुआ था डिप्रेशन, मुझे तब कितनी तकलीफ हुई थी, और वो जब ठीक हो जाते हैं और अच्छा फील करने लगते हैं तब रियलाइज होता है.
There's a reason to that. जब your head is below the water, all you're trying to do is survive. You don't have so much of सद्बुद्धि कि आपको समझ आएगा आसपास क्या है. We're all smarter in hindsight. It's called hindsight bias for a reason. But you're right. It's good to seek help, even if there's a tad bit of confusion, resolution, something that you just want to vent. People go to therapy to just vent. They come once or twice, they vent, they go back. They write back saying, I felt better, thank you. Thank you for listening to me non-judgmentally. So there are multiple reasons why you can go.
Doctor, I really want to understand, ठीक है, ये हम समझ गए कि किसे जाना चाहिए. Now, let's go a level deeper and try to understand the mental health issues, right? हाँ, बहुत सारे words हैं वहाँ पे भी एंजाइटी, सैडनेस, डिप्रेशन, और बहुत लूजली यूज होता है. मतलब मैं सोशल मीडिया पे जाती हूँ तो अब तो मतलब 5 साइंस दैट यू हैव ADHD, और वो रील देख के मैं सोचती हूँ हाय कहीं मुझे तो ADHD
सबको हो रहा है, सब आजकल अपने आप को सेल्फ डायग्नोसिस कर रहे हैं. ट्रू.
तो मतलब हम ट्रबल में हैं, एंड वी नीड योर हेल्प टू रियली अंडरस्टैंड these the most common I would say problems: ADHD, OCD, anxiety, depression. How does one really understand the difference in what these are?
Before that, let me break down to you what is an issue, what is a problem, and what is a disorder. To explain it, make it more simpler. खांसी एक दो बारी होना क्या है, रेगुलरली बहुत ही खांसी करना क्या है, और ट्यूबरक्लोसिस क्या है. ठीक है, मुझे आज खांसी हो रही है क्योंकि मुझे इस रूम में किसी से चीज़ से एलर्जी है, ठीक दिया मैंने, खांस दिया, इट्स ओके, इट्स अ स्मॉल इशू, राइट. इट बिकम्स अ प्रॉब्लम अगर मैं रोज ही खांस रही हूँ. अब आप कहोगे आर यू ओके, राइट. अब मैं खांस रही हूँ, आई हैव वेट लॉस, आई हैव लॉस ऑफ एपेटाइट, आई हैव अदर सिम्टम्स ऑफ ट्यूबरक्लोसिस. दैट्स अ डिसऑर्डर, दैट्स अ डिजीज, राइट. तो मेंटल हेल्थ के रेल्म में अगर हम देखें तो इश्यूज क्या हैं. इश्यूज आर रिजेक्शन, आपने मुझे क्यों रिजेक्ट किया, फ्रेंडशिप्स टूटना, टीचर का डांटना, पेरेंट का बच्चे को कुछ बोलना, हस्बैंड का वाइफ के साथ नोक-झोंक कर लेना. These are issues. We all go through them,
Anything
right?
that's disturbing us.
Correct. We all go through them, right? Multiple times a day. Uber वाला नहीं आया, issue, right? Now comes the problem. Problem are usually external stressor related for most people. जैसे कि मेरा एडमिशन नहीं हो रहा है. It may resolve with time. Do you see? मेरी शादी नहीं हो रही है. मेरा बच्चा हुआ है, I'm postpartum, there are blues. Again, there's a clear cut indication. जरूरी नहीं है होना हर बारी, but that's more a problem you can see, right? Adjustment problem, जैसे हमने पहले discuss किया. Now comes the extreme most version, the ones you were asking about. Those are disorders.
So doctor, इसमें एक duration की element है, right?
Absolutely on point. Yeah.
Can we define it? Because let's say if a symptom is sad feel होना और रोना, कभी कभार एक दिन रोना आ गया is okay. अगर मैं रोज रो रही हूँ और ये 7 दिन चला, तो what is it? And what is it? Like, is it 7 days? Is it 4 days?
You ask a very pertinent question, honestly. I teach a lot of medical students. I think आप एकदम medical वाला exam ले रहे हो मेरा, अच्छी बात है. It's a very good question. Let me tell you about the top 2-3 diagnoses. पहले तो हम कैसे डायग्नोज करते हैं. हमारे पास एक होली बाइबल है, एक का नाम है ICD, एक का नाम है DSM. उसके अंदर सारे क्राइटेरियाज ब्यूटिफुली लिखे हुए हैं. इट्स ओपन, एनीबडी कैन रीड इट, बट इट्स हार्ड टू पिक दोज आउट. दैट्स वेयर अ डॉक्टर कम्स इन. अदरवाइज तो सभी अपने आप कर लेंगे सेल्फ डायग्नोज. डिप्रेशन is loosely used. It's actually major depressive disorder. नाम है major depressive disorder, MDD. Okay. Minimum 15 दिन. Max could be whatever. For most of the time, not all the time. Nobody's going to cry 24/7. Nobody's going to cry 7 days at a stretch as well. For most of the time, you have low mood. You have a constant fatigue feeling despite getting enough rest, right? And you have a sense of, along with that, guilt, lack of concentration, too much or too little sleep, appetite issues, self-esteem issues. I'm not good enough. I'm useless. I'm worthless. I'm hopeless. Crying spells for no apparent reason. Feeling maybe irritable and angry with loved ones over small little things. And suicidal ideations. ये कंपल्सरी नहीं है. ये होने से डिप्रेशन सीवियर हो जाती है. इनफैक्ट डिप्रेशन कम्स इन लाइक हाउ अ पेग कम्स इन स्मॉल मीडियम लार्ज, और हाउ योर कॉफी एट स्टारबक कम्स इन लाइक स्मॉल मीडियम लार्ज. सो लार्ज इज व्हेन सुसाइडल आइडिएशंस आर देयर. सो ये हो गया डिप्रेशन का इन अ जिस्ट. एंजाइटी में खुद भी बहुत सारे टाइप्स ऑफ एंजाइटी डिसऑर्डर्स हैं. सो देयर इज जनरलाइज्ड एंजाइटी डिसऑर्डर, व्हिच मीन्स पीपल हु वरी अबाउट एवरीथिंग. Every time the house is on fire, what if this happens? What if that happens? I call it a what if syndrome. Like, what if my bus leaves? What if I don't get there on time? Then what if, at least for 6 months, one needs to have anxiety symptoms most of the time. 6 months. बढ़ गया,
बहुत
right?
लंबा है.
Panic attack के लिए, over the last 6 months, if you've had a few panic attacks. Bipolar disorder के लिए, जिसमें highs and lows होते हैं, I call it the roller coaster. टू हैप्पी टू सैड. अब कभी कभी टू हैप्पी टू सैड मैं भी होती हूँ दिन में, डजंट मीन आई हैव बाइपोलर डिसऑर्डर. एटलीस्ट मेनिया सिम्टम्स 7 दिन तक रहने चाहिए. और मेनिया क्या है? एकदम बैंग ऑपोजिट ऑफ डिप्रेशन. You're super happy as if you won a lottery, but you haven't. You're talkative. Nobody can stop you. You have great, grand ideas. आप सोएंगे नहीं रात रात भर. One of my patients said, I know the biggest leaders of the country. One of them spent so much money buying things they couldn't afford. Some of them started to become over religious. ये सारी चीज़ें मेनिया में देखी जाती हैं. Again, for 7 days minimum. So, ये आर्बिट्री एक आधी रात एक आधा दिन होना इज वेरी डिफरेंट. स्किज़ोफ्रेनिया के लिए कह लीजिए 30 days of symptoms is needed, not just one day of somebody saying, you know what, I can hear voices. No, it's not schizophrenia. So हर disorder की there is method to madness is what I like to say. There are diagnostic criteria, there are stipulated period of time that you need to have those for. ऐसे arbitrary नहीं है.
Got it. I think this is going to be very useful because I really want people watching, if they're going through some of this, to realize that I am right now a good candidate to go and seek help.
Sure.
I think
You've
that's
been feeling the same way for a month. I mean, please go speak with someone. You've been struggling for 1 year. Please speak with someone. कल better हो जाएगा, कल better हो जाएगा. Exercise कर लेता हूँ better हो जाएगा. Let me sleep over it better हो जाएगा. Let me talk to a friend better हो जाएगा. Sure, try everything, please. But set yourself some timeline कि इतने टाइम के बाद फिर जाना चाहिए ना एक्सपर्ट के पास.
Good point. Doctor, the other thing that I really want to understand is people who are around this person going through. Let's pick depression. Let's say आपकी family में कोई member है जो depressed है, जो sad है. So what is the right thing to do if, let's say, your mother or your partner is going through a tough mental health situation?
Can we talk about the wrong thing?
Let's start with the wrong
Rather
don'ts.
than the do nots. I think do nots are far more important क्योंकि हम instinctively do nots कर बैठते हैं. Right. Please don't say क्या तुम नाटक कर रहे हो. That's the worst thing to hear. पता है लोग खुद को self doubt करने लगते हैं. Am I making this up? I'm feeling this way. मुझे ठंडी लग रही है, but am I making it up that it's cold? Who's even done that? Right? Second, please do not use labels like तुम पागल हो गए हो, तुम ungrateful हो, हम तुमको छत देते हैं, I give you love, I give you time, what do you give me in return? They don't have the resources. उनका पैर टूटा हुआ है, उनसे आप बाजार से सब्जी नहीं मंगवा सकते, right? So it's the same way. They don't have the emotional bandwidth. Another thing to not do at that time is to be giving sermons and giving them परवचन्स on आपको पता है मेरे साथ भी ऐसा हुआ था, तुमसे ज़्यादा हुआ था, अरे तुम्हें पता नहीं मेरे साथ क्या क्या हुआ है, I've been through worse than you, and look at me. Somehow it becomes about the person who's supposed to help us, but जो बेचारा डूब रहा है वो डूब जाता है.
तो ज्ञान मत दो.
ज्ञान देने का भी तरीका होता है. Let's be honest, right? ज्ञान should not be in the way to बेचारे की already self-esteem टूटी हुई आप और तोड़ दें. So these are honestly do nots. Do not make it about yourself. Do not call them words which will be hurtful. And do not invalidate their feelings. कि तुम नाटक कर रहे हो. Now let's flip to the do's. जिन लोगों को नहीं पता क्या करना है, ask the person, can I do something for you? अगर मुझे चाय चाहिए कि कॉफी आप मुझसे पूछते हैं, तो मुझसे ये क्यों नहीं पूछ लेते कि क्या चाहिए इमोशनली बस, राइट? सेकंड, चलिए ठीक है, वो आपसे नहीं बता रहे हैं, दैट व्हाट डू दे वांट? कैन यू जस्ट सिट विद देम, जस्ट बी अराउंड देम, डोंट टॉक. जरूरी नहीं है चलो वीडियो गेम खेलते हैं साथ में, ग्रेट, बॉन्डिंग हो रही है, लोनली नहीं फील कर रहे हैं, यूर अराउंड देम, राइट? यू कैन आस्क देम if they are ready, when they are ready. Do you think we can go talk to someone together about this? मैं तुम्हें पागलों के डॉक्टर के पास ले जाऊंगा, प्लीज मत बोलिएगा, एक तो मेरा भी नाम खराब करते हैं, उनको हवा क्रिएट करते हैं. How many people would like to come to speak with me? So people are either brought to me or people come to me, and I strongly see the difference. The people who come to me
respond better, I'm sure.
100%. Who are brought to me, they are so skeptical. They're like, this is punishment. I've been brought to this doctor with a label कि मेरा खिसक गया है. That's what it's believed. आपने आलिया भट्ट का डियर जिंदगी में सुना होगा that I'm taking therapy. मैं पागल हो गई हूँ. Ku. That's the idea people have in their head, right? So maybe talk to them. Hey, do you want us to go and understand what's going on? I'll go with you. You don't want to go? I'll go for you and understand and come back. Be brave enough to go to a psychiatrist and talk about your friends' issues and come back and understand better. So many people these days, I'm so glad, are coming up and saying, my partner has this diagnosis. What can I do to better support them? It's really come around. In the last 13 years, it really elates me to say that people are getting better awareness. So this person, so many people come in and say, मैं अपने बच्चे की autism को कैसे better manage करूँ? कैसे बच्चे को ठीक करूँ नहीं, mind you. How do I manage myself also better कि बच्चा भी इससे benefit करे? My partner is going through borderline personality disorder. How do I know better to respond to them? So we've come around. So that's what you can do. Ask. Don't preach. Definitely. Go with them. Just sit with them.
So, doctor, now we know what to do and not do with a family member or someone around us going through a tough time. Is there anything we can do for ourselves? Because as a partner, it's also, agar ye cheez lambi chalti rahe, so it's also very difficult, and sometimes, I mean, you don't want ke husband depressed tha to eventually wife bhi depressed ho gayi because she was handling husband for such a long time. So as a caregiver, anything that one can do to become emotionally stronger or protect themselves for this?
Absolutely. There's a term for this called caregivers burnout, जो हो जाता है क्योंकि हम दूसरे को हर समय सेव करने में इतने बिजी हैं कि खुद की ध्यान रखना एकदम भूल गए हैं. So, on the flight, there's this announcement, right? Always put on your own oxygen mask before putting on others. People don't follow that when it comes to this. उनको लगता है मेरा तो हो जाएगा, it's okay, I'll manage, but I need to take care of this person. So, caregivers से मैं हमेशा ये बोलती हूँ, पहले आप अपने resources check करिए. You can't pour from an empty cup. आपके पास ही नहीं है पानी पीने को और आप दूसरे को लास्ट बूंद भी पिला देंगे. I'm not saying be selfish, but थोड़ा सा सेल्फ के सर्वाइवल के लिए ज़रूरी होता है. सो केयर गिवर्स के साथ मेरी हमेशा एक रिक्वेस्ट रहती है, डोंट फॉरगेट हु यू वर, कीप गोइंग बैक टू थिंग्स दैट मेक यू हैप्पी. आप अपना स्ट्रेस लेवल मैनेज करते रहिए तो होपफुली आपको उतना डिसऑर्डर, अगेन इशू, प्रॉब्लम, डिसऑर्डर तक नहीं पहुंचने पड़ेगा. एंड दिस कुड बी बाय इवन जस्ट मेकिंग श्योर यू स्लीप वेल. Maybe your partner's not sleeping well at night, but you recognize that you need that sleep. So it's okay to prioritize, or maybe get that sleep in the day if you can, if you have the luxury to. But खुद का खाना dismiss करके दूसरे को खाना खिलाना, this is so common, especially with, I would say, parents towards children as well. So please always take care of yourself.
आपकी इंस्टाग्राम पे मैंने एक बहुत इंटरेस्टिंग चीज़ देखी थी, साइकोलॉजिकल टूल किट. हमें भी वो टूल किट दीजिए प्लीज.
अपनी बनानी पड़ती है, that's the fun part. Okay, so हम सबके घर में एटलीस्ट या तो एक सेफ्टी टूल किट है, जैसे कि अगर कोई गिर जाए तो उसको बैंडेड, सैवलॉन, ऑइंटमेंट लगाने के लिए. कुछ लोगों के घर में ऑब्वियसली टूल किट वैसे भी है कि एक स्क्रू ड्राइवर, पेचकस, थिंग्स टू मेंड बेसिक थिंग्स अराउंड द हाउस. आर्ट किट भी है, बच्चों की होती है, राइट, फेविकॉल एंड ग्लिटर्स एंड नॉट. ऐसे ही हम एक साइकोलॉजिकल टूल किट बना सकते हैं. बट देयर आर टू काइंड्स दैट आई वांट टू एम्फसाइज ऑन. One is that you need to use every day. So sort of like brushing your teeth. So dental hygiene is everyday job. Mental hygiene is also everyday job. ठीक है. तो ये हो गई आपकी everyday to psychological toolkit. दूसरी है आपकी SOS psychological toolkit. We'll come to that. Everyday psychological toolkit में कुछ चीजें जरूर रखना. Number one is sleep. I can't emphasize enough. हमें नींद का डॉक्टर भी बोला जाता है sadly. But sleep is the number one advice I would give my teenage self if I could go back in time. By 20s, it got better. I realized that I functioned so much better if I've slept well. And in 30s, sleep is my number one priority. After becoming a parent, even more so. Sleep is the first thing in your psychological toolkit. What you eat, your diet, your nutrition is another important thing in your psychological toolkit. मूवमेंट इज अ वेरी इंपॉर्टेंट थिंग इन योर टूल किट. यू नो, अभी हम बैठे हुए हैं, मैं कभी कभी दिन में, आप बिलीव करोगे, 8-8 घंटे बैठती हूँ काम पे. आई मेक इट अ पॉइंट टू गेट अप इन द मिडल, जस्ट वॉक अराउंड एंड कम बैक, दैट्स इट. अनदर इंपॉर्टेंट थिंग इज द सन. वेरी इंपॉर्टेंट. अरे इंडिया में तो भरा हुआ है, बाहर निकलो.
और हम लोगों ने बाहर निकलना बंद कर दिया है.
Absolutely, people are so scared. आप बिलीव करेंगे, कभी कभी मैं, सो आई वर्क ऑनलाइन, कंसल्टेशन कर रही होती हूँ और पेशेंट के बैक में दिन में इतना अंधेरा होता है. आई रिक्वेस्ट देम टू प्लीज कैन यू गेट अप एंड ओपन द कर्टन्स. नहीं, धूप आएगी.
धूप
आनी चाहिए. सो दैट्स अनदर वेरी इंपॉर्टेंट थिंग, राइट? द नेक्स्ट थिंग इज सोशलाइजिंग. Super important. Lonely people have higher chances of mental health issues. There's enough WHO data about it. Recently, US Surgeon General called loneliness a pandemic in itself. It's that bad for us.
You think social media is deeply involved in making us lonely?
Somewhere, yes. But there's more to that. It can't be just the only culprit, surely. So, sleep, what you eat, how you move, Surya Devta, right? Social, very, 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 very important, right? And one more add-on could be your soul. Whatever makes your soul happy. Music, art, you know, just hanging out, just doing nothing sometimes, it's okay. Meditating maybe, whatever. Me time. जो भी चाहिए, doesn't matter. Doesn't need to have a definition, right? ये आपकी रोजमर्रा की साइकोलॉजिकल टूल किट होनी चाहिए. रोज इसमें से ये 5-6 चीजें निकलनी चाहिए बाहर, वापस डलनी चाहिए. नाउ कम्स टू द SOS टूल किट. जब कोई गिर जाता है एंड दे हैव अ स्क्रैच, अ boo on their leg, what are the things we do? We wash it, we clean it with Savlon, we put an ointment, you know, we put a band-aid. ये 2-3-4 चीजें बहुत जरूरी हैं. आपकी एक स्ट्रेस मैनेजमेंट साइकोलॉजिकल SOS टूल किट होनी चाहिए. Let me ask you, what do you do when you're stressed out?
Sometimes I just take a break. I go for a walk.
Wow.
I work out. Maybe if मेरे पास 10 मिनट है तो 2 मीटिंग के बीच में breathe in, breathe out. Drink water.
Yes, yeah, absolutely. Take care of your body, basically.
Yeah.
आपकी टूल
And
किट कॉपी
एक
करनी
और-
चाहिए
एक
सबको.
और है जो मैं बोल नहीं रही हूँ क्योंकि चोरी पकड़ी जाएगी, इसलिए कुछ अच्छा खा लेते हैं.
So fine, you're listening to what your body needs.
Let's go out for dinner.
Absolutely.
कि you know, या कुछ फेवरेट कुछ डिश बना लेते हैं आज.
Sure. Feel good खाना excessive होगा तब it is a problem. Comfort eating when done in excess is a problem. But sure, absolutely. Feel good अगर खाना है, गाना है, क्या फर्क पड़ता है, right? So there you go. You talked about something that you do for your body when you're stressed. You take a walk, right? Go connect with nature. Excellent, right? Maybe exercise if you can, right? Second thing is something for your mind. So break ले लिया, थोड़ा सा nap ले लिया. Excellent way, right? Some people like to meditate. Some people like to journal. Why not? पर ये सब चीजें लिखनी है कहीं पे अपने लिए पहली बार. Eat something if you'd like. It's perfectly fine, right? Have that SOS friend on your speed dial, please. So again, borrowing from your regular toolkit, उसका ही एक SOS version होना चाहिए that you use in time of distress. उस समय, sorry to say, when we are down in the dumps, दिमाग नहीं चलता है, तो what should I do? So with so many of my patients and clients, we make the psychological SOS toolkit. And हम कहते हैं ठीक है, जब distress हो रहा है, निकालेंगे. Let me try this today. Let me try that today. Come back, tell me which ones worked. Great. You have your own toolkit. I have my own as well. So every now and then I go back to it and reflect, I haven't tried this one in a while. Let's go do it. So that's your SOS and your regular psychological toolkit.
Dr. Era, I was going through some statistics around mental health and I came across this very interesting by UNICEF, which said that 14% of young Indians are actually depressed. और ये बढ़ गया है. मतलब if you look at a trend line, this is increasing. Why is it that younger people are more depressed now?
A lot of people presume कि बच्चों को कोई mental health issues नहीं होते हैं, right? Which is why they take longer to actually get children to seek help. Although some parents are on the fence about it and immediately seek help because बच्चे सबको बहुत प्यारे होते हैं, they want to take action as well. If you can see, the society's changed drastically. Number one, we live more in nuclear families than joint. Now, I'm not saying कि joint families ही रहना चाहिए, उससे कोई mental health issue नहीं होते. That is not true. There is enough trauma sometimes due to joint families also. So let me put it out there. But nuclear families does mean थोड़ा सा ज़्यादा loneliness. One. Second, teenage अपने आप में एक ऐसी stage है, if you go back, where one tries to find themselves, right? Who am I? I want to fit in, but I don't want to kind of, be everybody else. I want to have a unique identity also. Now, how do I fit in, but also have a unique identity? I have that crush. Do I tell them? What if they reject me? There is so much going on in that mind. There's so much going on in the body, in the hormonal section as well, right? Your body is going through complete flux, complete change. And सबसे बड़ी बात, उस समय you do not feel like listening to people like parents. You want to listen to friends. Peer pressure itself is a very big factor why young people can have mental health issues, whether that's bullying, whether that is, not letting them fit in, making them feel more isolated. Aajkal cyber trolling is really in, very, very common. So it's also a stage where a lot of us want to figure what do we do with our career. So much competition. So where am I going? What's the point? When will I actually have some semblance of me? Who am I? So all that confusion does lead to more mental health issues, including diagnosis of depressive disorders, anxiety disorders. For that matter, very common substance abuse. आप believe नहीं करेंगे कितने young लोग इस stage पे, whether that is smoking, whether that is weed, ganja, whether that is just with any drug, alcohol, start करते हैं in order to feel better initially. So young people are always our worry because they are the future, right? We need to take care of them. And yet, because parents keep on focusing only on academics these days, there is no idea around the fact कि mental health भी ज़रूरी है. So we keep pushing for schools to provide school counseling, to pick up kids who need help and support, to give them accommodations if they have ADHD, if they have autism, if they have, depressive disorder, छुट्टी बहुत दिन ले ली. We do keep working with schools to create awareness for teachers to understand कि कैसे बच्चों से deal करें. But yeah, it's such a need of the hour.
Doctor, I think as a teenager, I remember, जब आप बात कर रहे हो, मैं अपनी teenage life और अपनी college life के बारे सोच रही थी. And I completely agree, it's a very tough time. But I think I feel bad for teenagers now because with social media, it's just so much more tough. There is comparison happening at a larger scale. और मुझे कभी ऐसे लगता है कि और कॉम्प्लिकेट हो गई इन बेचारों की लाइफ जो हमारी थी एज टीनेजर्स.
Maybe.
Do you see that with certain kids coming to you? I'm sure you see these patients on a day-to-day basis, that social media is in some way playing a big role in making their life tougher or making them feel कि मैं सही से दिख नहीं रही हूँ. Issues around how they look or how they compare with peers.
I think insecurities वही हैं जो हमें थी, magnify हो गई हैं because platform change हो गया है. Earlier, what you and I were really mattered only to the close-knit friend group, maximum हमारा school. Now it matters to 1,000 people that may be on your feed, on your Snap, or just in general connected with you somewhere. But social media for these children, and even for us, forget children, social media in itself क्या है? Why is social media so popular for all of us to head to the moment we are feeling tired, bored, angry, sad, कुछ भी feel हो रहा हो? क्योंकि एक instant gratification और instant validation मिलती है.
हाँ, मैंने फोटो डाली, मुझे लाइक मिला.
Correct.
तो मुझे खुशी भी मिली.
Correct. People are looking for echo chambers. कौन मेरे साथ साथ agree करता है? That's how tribes are made, right? कौन मेरे साथ साथ है? Oh, 10 people are thinking the way I'm thinking. Great. तो 10 लोगों ने मुझे like कर दिया. Oh, अब 20 ने कर दिया. And it's very interesting. Each time you open one of these social media platforms, आपके ब्रेन ने कुछ सोचा हुआ है कि क्या रिवॉर्ड चाहिए. अब बहुत इंटरेस्टिंग बात होगी. या तो रिवॉर्ड होगा equal to what you expected, तो आपको ठीक लगेगा, या तो रिवॉर्ड होगा लेस देन व्हाट यू एक्सपेक्टेड और आपको सैड फील होगा, या तो रिवॉर्ड होगा मोर देन व्हाट यू एक्सपेक्टेड एंड बूम you'd want to do this all over again.
It's
So,
addictive.
Very, very addictive.
What is your opinion as a doctor to what or how should we as humans handle social media? How do we sort of, I think it's not about just the kids, every age group, the amount of times we sort of go to our phone. My father was visiting the other day and I realized that 3 hours के लिए वो आए थे मुझे मिलने, उसमें से आधे से ज़्यादा टाइम वो अपने व्हाट्सएप पे फॉरवर्ड्स देख रहे थे. मैंने उनका फ़ोन छीना, मैंने कहा आप मुझसे बात करने आए हो ना, और वो रियलाइज भी नहीं कर रहे थे कि वो कर रहे हैं. सो आई थिंक एवरीबडी इज अफेक्टेड. हाउ डू वी रियली कीप अ ट्रैक ऑफ दिस थिंग नॉट डिस्टर्बिंग? बिकॉज आपने कहा कि हमारी टूल किट में सोशलाइजिंग भी ज़रूरी है. अब जब मैं लिफ्ट में घुसती हूँ तो 5 लोग अपने अपने फ़ोन में लगे हुए हैं, उसमें से 2 यंग लोगों ने तो हेडफोन पहने हुए हैं, तो मैं सोशलाइज किससे करूँ?
We'll come to socializing in real IRL, in real life किसके साथ करना है. But आपने बहुत इंटरेस्टिंग लाइन बोली, it just came out very organically. हम सोशल मीडिया कैसे ठीक यूज़ करें, हम सोशल मीडिया कैसे मैनेज करें, सोशल मीडिया हमें कैसे मैनेज करे नहीं. That's the beauty. Is social media managing you or are you managing your social media? It's a very thin line and that's the twist. If you can control better, and by that I mean have better boundaries, social media is not only bad. I would say it's good, bad and ugly, right? Ugly बहुत आसान है समझना. Good, it's a place to vent, it's a place to socialize, it's a place to connect, it's a place to find new ideas, it's a place where probably we got connected, it's a place where people will watch this information. Bad, because yes, IRL in real life नहीं कर रहे हैं हम, तो I'll text you, how are you, sitting here, right? That's definitely a downside. The trolling is a downside. The validation constantly seeking is a downside. Ugly is the addiction part, of course. Let me tell you how I like to manage my social media. Of course, I am on social media. If anybody would say, "Arey, bilkul mat use karo," good for them. If they can go cold turkey, they don't want to be on social media, more power to them. Great. ज़रूरी नहीं है. It's not सांस थोड़ी ना है कि लेनी है. But for most of us, we do not sit, pause and think about it. अगर मेरी ड्रिंकिंग एक्सेसिव हो रही है and I can sit, pause and think about it, वैसे ही अगर मेरा सोशल मीडिया ज़्यादा हो रहा है, sit, pause and think about it. Every weekend I sit down and look at my weekly stats. That's one thing I do. Number 2, when I'm talking to patients, the phone is not near me. It's a distraction in general. Number 3, no notifications on. Ever. Not even for WhatsApp.
आप डिसाइड करोगे कब आपको कौन सी ऐप खोलनी है.
Absolutely. ऐप नहीं बताएगी मुझे, right? If it's urgent, call me. Good old calling works, right?
Yeah.
I do use tons of apps to even block my social media. They're amazing apps. You can use apps to fight apps. है ना? आपस में झगड़ा करवा दो. Set systems in place. I have told my little one that when mama's with you, mama will put her phone away. If you find mama on the phone, once is okay, maybe it's urgent, but don't let mama be on the phone. I put a monitor on my head. It works like a charm. Kids are very good reflection. Oh, you're not talking to me. इससे अच्छा है पहले ही बोल दो कि आप भी मुझे टोक लेना, हम तो आपको दिन भर टोकते हैं, right? And finally, my biggest strength on social media comes from the fact that create more than you can consume. अगर देख रहे हो रेसिपी तो जाके बना लो. अगर सीखा है कुछ from this podcast तो जाके please apply कर लो. So you're creating something out of it, right? कंटेंट क्रिएट भी करना एक क्रिएशन है, राइट? बट ये बोलना कि आई एम वर्किंग, कि ये मेरा वर्क है, तो फिर वर्क लाइफ बैलेंस में वर्क भी खत्म होना चाहिए. सोशल मीडिया कांट बी योर गो एंड डू इट ऑल. इट कांट बी योर फन, कांट बी योर सैड प्लेस, कांट बी योर हैप्पी थिंग, कांट बी योर वर्क, कांट बी एवरीथिंग. सो डोंट लेट इट अफेक्ट योर मूड एंड योर relationships and your day-to-day life. If it does, go cold turkey for a few days, no problem. Maybe step back, reflect, set systems in place, and think hard. what am I getting from social media जो मुझे रियल लाइफ में नहीं मिल रहा है? वो ही घड़ा भर रहे हैं ना हम कहीं पे तो जाकर.
बहुत सही बात बोल रहे हो. जैसे ही इमोशनल ईटिंग है, in fact, I was reading this book called Undistractable, which is all about what you said in the last few minutes. And it said that कुछ कमी है लाइफ में और वो कमी भरने के लिए हम यहाँ जा रहे हैं. So rather than going there, think and ask yourself कि why at this moment I was pushed to touch my phone.
Absolutely. Absolutely. It's interesting. रात के टाइम पे सबसे ज़्यादा सोशल मीडिया यूसेज होता है, आपको पता है. And there's a psychology behind it. We are tired from the day. हमारी विल पावर ज़ीरो है उस समय, तो रेजिस्ट करने का मन नहीं करता है. Second, there's something called revenge bedtime procrastination. या मैंने पूरे दिन काम किया है, I deserve a break. पहले बॉस बोल रहा था, घर वाले बोल रहे थे, this is my me time. I deserve to waste time. Right? Doesn't it happen to all of us? I've been guilty at least.
Yeah.
See, at no point will I ever tell people कि मुझे नहीं हुआ है, क्योंकि मैं भी इंसान हूँ. So revenge bedtime procrastination रात को solid होता है, इसलिए लोग अपने पोस्ट रात को पोस्ट करते हैं, right? Insomniacs ढूंढते हैं basically, right? Because we have a little one, I think thanks to her the system is in place कि उठना है सुबह. तो रात को अगर कभी पकड़ती भी हूँ ना मोबाइल, तो I ask myself, A, I have a deadline कि इसके बाद नहीं उठाना है. Second, I ask myself, सच्ची में मन कर रहा है, सच्ची में मन कर रहा है. Do you really want it or do you need it? I don't want it nor I need it, just go to bed, right? So we have to ask ourselves. We don't talk enough to ourselves, I feel. That's a problem.
Doctor, another piece that I want to talk about is loneliness. You said as well, right, कि loneliness pandemic बन गया है. WHO ने बताया है कि loneliness is a serious problem. It's a public health issue and there are policies being made ke how to sort of solve for loneliness. What is the connection between loneliness and mental health issues, and what to do if one is lonely?
There's this excellent TEDx talk that everybody should watch by Johan Hari, and his book is about lost connections. उन्होंने बहुत beautifully एक concept समझाया जो कि evolutionary है. We all used to live in tribes. When we were cavemen, हम लोग सब साथ साथ रहते थे. जिस इंसान को lonely कर देते थे, they would shun them out of the tribe. वो invariably मर जाता था. They would perish, right? Similarly, उन्होंने अपनी book में लिखा है that when somebody is sad, they are craving for some connection. तो उनके आसपास जाके बैठना is a big part of the connection, right? Our brain evolutionarily needs connections. When we are born, we need our mother, we need our father. Our mirror neurons start firing, right? When I see someone smile at me, automatically उठ जाता है. आप सोचते हैं, we just smile. We don't smile enough at strangers these days. The major cause of loneliness, in my humble opinion, these days is one, because of being distracted. Two is cynicism. हम बहुत cynical हो गए हैं. मैं आपको स्माइल करूंगी, आप मेरे बारे में क्या सोचोगे? Why should I be nice to you?
मैं इसे जानती भी नहीं हूँ.
मैं तो आपको जानती भी नहीं हूँ. Exactly. Another thing is individualism. हम बहुत ज़्यादा me, I ज़्यादा हो गए हैं ना. अच्छा नहीं लग रहा है ये relationship, I'm cutting you off. I'm cutting you off. I'm also cutting a connection off. I forgot that. I'm not saying be in a relationship which is detrimental for you, but don't keep cutting people out of. ये बहुत trend हो गया है. The number one thing people ask me these days is, oh, मुझे अच्छा नहीं लगता है, ये मेरा relative, ये मेरा partner, ये मेरा XYZ friend. Should I just stop talking to them? We want to isolate ourselves. How will that work? So loneliness is a very big problem. How to connect? जब मैं ये बोलती हूँ,
और आप एक बोल रहे थे IRL.
in real life.
In
Thank
real
you.
life.
Absolutely.
I'm learning.
Gen Z, even I learned so much from them, right? So definitely in real life connections will always be better than a Zoom connection that you and I have. Better than no connection. Zoom connection may be better than no connection, of course, or a social media connection may be better than no connection. But जब हम really सामने मिलते हैं, I feed off your body language, you feed off mine. हम एक दूसरे को एक तरह से mirror कर रहे हैं, right? There is a bond, and that leads to oxytocin release in our brain. That leads to a feel-good feeling. Feels like a warm hug. We actually touch and hug people when we are near them. And that is excellent for bonding. अब आई बात bonding की in this horrible time where it's so hard to find free people because everybody's super busy, right? जब भी मैं बात करती हूँ किसी से कि I think we should find you some social connections, their first point is there's not enough people of my kind. We are very picky. We are very selective. I only want to hang out with this particular kind of crowd, nothing less than that. मैं बोलूँ हमारे हेल्पर्स के साथ भी हमारा अच्छा सोशल बॉन्ड हो सकता है. हमारे कभी कभी वॉचमैन हमारे साथ अच्छा सा बॉन्ड रखना चाहते हैं. स्टॉप बीइंग अ क्लासिस्ट प्लीज, दे आर रियल पीपल. आपने कभी सोचा है हम अपने से ज़्यादा बड़े या कम उम्र पर्सन के साथ भी बॉन्डिंग कर सकते हैं? You can go and be friends with that elderly gentleman in your complex who likes to walk downstairs, sit and listen to their stories. It's bonding. It's lack of loneliness. You can find groups. There are sports groups in almost every city. You can find a sport where people get together. कोई बात नहीं करता, सब अपना sports खेलो. There are board game nights in cities like Bangalore, Mumbai, Delhi, Kolkata, where everybody just gets together, plays board games, tata bye bye, right? Find connections है in real life. बहुत आसान है बोलना they don't exist. Then how is half the world finding them? Make it a priority. Don't make it an option.
I think we don't realize how important this is.
Absolutely.
And the fact that this is part of your toolkit.
Absolutely. Totally.
आई थिंक हर डॉक्टर की कंप्लेन होती है कि पेशेंट गूगल करके अपने आप को हमसे स्मार्ट समझते हैं. वेरी रिसेंटली आई गॉट टू नो अबाउट दिस टर्म साइबरकॉन्ड्रिया, व्हिच इज अ कंडीशन जहाँ लोग सब ज़्यादा ही गूगल करने लगते हैं. सो आई रियली वांट टू अंडरस्टैंड, डू यू रियली फेस दिस जहाँ लोग सेल्फ डायग्नोज कर लेते हैं, एंड do you face this on a day-to-day basis?
Every day. You are right. Every doctor's biggest nightmare is Google Doctor. But interestingly, hypochondria is actually called hypochondriasis or illness anxiety disorder, or in fancy terms, doctor shopping also, because they will keep looking for doctors as well, and they'll keep looking for a diagnosis. They may not have a diagnosis. I tell people, do you want good news or bad news? And they say, okay, bad news. Okay, bad news is you don't have a diagnosis. Good news is you don't have a diagnosis. Stop looking for one, please. And they're like, but I have a diagnosis. कुछ तो problem है. अरे boss, नहीं है problem, right? But have you ever wondered why people do this? We all like a semblance of control. We all feel like we want to know. It's great to know. I strongly believe करना चाहिए Google for knowledge and primary awareness. Sure. Plane कैसे उड़ता है आपने Google किया है क्या? Or do you just get onto an aircraft and trust the pilot? So, okay, maybe you would want to know which flight am I sitting on? What is the make of this aeroplane? Lovely. But you do not get into the nuances of कि कैसे उड़ाते हैं हवाई जहाज, unless you're a pilot yourself. Similarly, please Google, but know that Google comes with your own cognitive bias. When you have typed in those keywords, आपने कुछ सोच के टाइप किया है, Google आपको उस हिसाब से आंसर दे रहा है. सेकेंड, गूगल आपका पर्सनल डॉक्टर नहीं है, वो आपको एक ओवर जनरलाइज ओवरव्यू दे रहा है, राइट? द मोस्ट लाइकली थिंग्स दैट आर टू हैपन इज हेडेक, nausea, vomiting, death. Always death and cancer.
Ends at cancer.
That's right. अगर आपको फिर भी करना है गूगल, maybe ask the doctor you have seen, doctor, can I read up about it? It's fine. I also encourage. Why don't you go home, read up a little bit more about it? Reddit पे लोगों की ओपिनियन होती है, लिव्ड एक्सपीरियंस होता है, राय होती है, ज़्यादातर फैक्ट्स एंड एविडेंस नहीं होता है. नाउ अंडरस्टैंड व्हाट मेडिसिन इज. मेडिसिन एंड इवन मेंटल हेल्थ अप्रोचेस आर प्राइमरली बेस्ड इन एविडेंस एंड येस इन एक्सपीरियंस, बट योर एंड माई एक्सपीरियंस मे बी वेरी डिफरेंट टू द सेम मेडिसिन. डजंट चेंज द फैक्ट दैट अगर 100 लोगों को दी जाए तो मे बी आई एम इन दैट एरिया जहाँ पे एक पर्सन को स्ट्रेंज इफेक्ट हुआ है, बट 90+ लोगों को सेम ही चीज़ें होती हैं. सो विद ग्रेट पावर कम्स ग्रेट रिस्पॉन्सिबिलिटी. इफ यू आर गूगलिंग, गूगल विद रिस्पॉन्सिबिलिटी. गूगल टू फाइंड अ गुड डॉक्टर नियर यू who will patiently listen. But yes, Google diagnosis can be tricky.
And I think Google तो ठीक था, अब तो with all the influencers putting all the content, तो वो और ज़्यादा हो गया है कि ऐसा हो रहा है तो आपको ओसीडी है, ऐसा हो रहा है तो आपको डिप्रेशन है. हाउ डज वन रियली डील विद ऑल दिस?
Filter. Who is giving this information? Do they have the credibility, first of all? What are they set to gain from this? If there is even just eyeballs they're gaining or monetization they're gaining, it's probably something going on. Is it too simplistic? यार कैंसर का डायग्नोसिस इतना आसान नहीं होना चाहिए ना. सिमिलरली आई मीन देयर नीड्स टू बी डायबिटीज के डायग्नोसिस के लिए भी तो कुछ सवाल तो पूछते हैं डॉक्टर. ठीक है, ब्लड टेस्ट कराते हैं, बट उससे पहले भी तो कुछ पूछते हैं. सो क्वेश्चन, ऑलवेज बी क्यूरियस एंड क्रिटिकल इज माई मंत्रा, बट बी ओपन. सम ऑफ दीज मे बी रेलिवेंट टू यू. देयर इज अ वेरी इंटरेस्टिंग फिनोमिनन, आपके साथ जरूर हुआ होगा. अगर हमें कोई चीज पता चलती है तो वो हमें हर जगह दिखने लगती है. सो इट्स कॉल्ड द बेडर-माइनहोफ फिनोमिनन, विच बेसिकली मीन्स इल्यूजन ऑफ फ्रीक्वेंसी. बार बार दिखना. अगर मैंने लाल गाड़ी की बात की, लाल स्कोडा, दिस पर्टिकुलर मेक, आपको लाल स्कोडा दिखने लगेगी हर जगह, राइट? सो व्हाई डज दिस हैपन? अगेन, व्हेन यू ऑन सोशल मीडिया, यू हैव सीन सर्टेन सिम्टम्स, your brain will keep on wanting to look for those elsewhere over and over again. Maybe your hunch is right. Maybe it is a good way to explore that you may have something. Now, here's where I stand. Go to a specialist with an open mind. Listen to what they may want to say. It's a very popular thing. I've gotten enough hate and criticism for saying this earlier. I'll say it again. ADHD का diagnosis popularize हो रहा है. Now, what do I mean by that? ADHD is a truly neurodevelopmental disorder. बीमारी है, glorified कोई diagnosis नहीं है जो लोगों को चाहिए. Why are people going for it? Is the first question. क्यों लोग बहुत happy हैं ADHD diagnosis के साथ? Happy नहीं होने चाहिए diagnosis के साथ, right? दूसरा, क्यों इतना over diagnosis हो रहा है? In America, there was a recent study of the last 2 years. There's been major over diagnosis of ADHD. Not that ADHD doesn't exist, but जैसे आपको डायबिटीज, आर्थराइटिस, ब्लड प्रेशर, 3 चीज हो सकती हैं, राइट? ऐसे आपको ADHD, साथ में मे बी पर्सनैलिटी डिसऑर्डर, मे बी डिप्रेशन, मे बी एंजाइटी, मे बी सब्सटेंस अब्यूज, मे बी बाइपोलर डिसऑर्डर भी हो सकता है. दिस इज वॉट पीपल डोंट अंडरस्टैंड. दिस इज वेयर अ स्पेशलिस्ट कम्स इन. दिस इज वेयर अ डॉक्टर सिट्स यू डाउन एंड सेज ये भी है. हाउ वी कम टू दैट डायग्नोसिस इज वेयर वी हैव स्पेंट 10-12 साल पढ़ने में. अगर इतना सिंपलिस्टिक होता
तो क्यों 12 साल पढ़ते हैं?
तो फिर ग्रोसरी लिस्ट की तरह सभी टिक करते रहते और कहते मुझे है, राइट?
Doctor, let's go back to the psychological toolkit that you mentioned. One very important piece and something that's very close to my heart as well is sleep. So I really want to understand from you क्या तरह के sleep mistakes लोग कर लेते हैं, and how can one really rectify what is sleep hygiene? How does one get the fundamental sleep right?
Absolutely. Sleep is so important. Like I told you, the one advice that I give young people and to myself is so jao, अच्छे से सो जाओ, right? Now, what is an ideal amount of sleep? There's a lot of debate about this. 6 to 8 hours is a very commonly thrown parlance. There are people who feel super fresh in 5.5-6 घंटा. There are people who feel fresh only after 9 hours. Everybody is different. तो ये स्ट्रेस मत लो कि घड़ी देखकर मेरे को 9 घंटा 8 घंटा आई है कि नहीं. This is the first mistake. That is, sleep anxiety is actually the first mistake. Sleep को लेकर भौवा नहीं बनाना है. Sleep is one of the most natural things. भूख, नींद, सेक्स, and for that matter, ये बेसिक हमारी ड्राइव्स हैं. प्यास, राइट? ये 4 हमको बहुत ही भगवान ने बचपन से दी है. So you don't have to overemphasize, but you must take care of it. I believe sleep is necessary, and scientifically it's been proven, not only from head to toe for everything, but like you said, for all the functionality as well. So we'll start with head. You will have premature graying of hair if you're not getting enough sleep, right? Hair loss hota hai logo ko. Very common reason is lack of sleep. People have more cardiac stress when they don't sleep very well, right? People have more brain fog, cognitive issues when they don't sleep well. Memory consolidation के लिए sleep बहुत ज़रूरी है. People have aches and pains when they're not well rested. People have bad digestive systems. People have disorders like anxiety, sleep. उन सब में sleep is one of the most core component, right? अब बात आती है हाउ टू सॉल्व. यू राइटफुली पिक द वर्ड स्लीप हाइजीन. जिम रोज जाना पड़ता है या हर दूसरे दिन जाना पड़ता है, उस पर मेहनत करनी पड़ती है. स्लीप पे भी थोड़ी सी मेहनत करनी पड़ती है. Doesn't have to be like a workout, but you have to give it some kind of routine. So, just like you brush your teeth, again, same way sleep hygiene is a set of protocols, that you should and should not do. Let's start with the do nots. I always like do nots before
Okay.
do's, right? Why don't people listening to this check how many do nots are they following into? Number 1, do you sleep at erratic hours? आज 10 बजे सो गए, कल 1 बजे सो गए, फिर अगले दिन 2 बजे, फिर 6 बजे. 1 hour gap here and there is perfectly normal. Most of us have it because of some obligation that we have. But do you constantly change your sleep timing? Number 1. How much caffeine do you take in a day? And especially after sundown. Do you get enough sunlight because your melatonin resets and you sleep better? Do you get enough movement and exercise in a day? Because if you're not tired enough, शरीर नहीं थका है तो माइंड नहीं थकेगा, तो फिर रात को नींद नहीं आएगी, राइट? इसके अलावा आप सोने से पहले क्या करते हैं? Have you completely not eaten? भूखे हैं आप? That's why you're tossing. Have you eaten too much? Are you overfull and stuffy? Is the room dark? Sugar. Have you had sugar, which spikes you and gets you very, very activated? Is your room dark? आजकल हम इतनी लाइट्स ऑन करके बैठते हैं, and ऊपर से the blue light of the device, which is scientifically known to disrupt your sleep, right? Then comes your devices, of course, from the point of revenge bedtime procrastination that we were talking about. You self-torturing yourself and saying, ये तो मजा आ रहा है, right? And one more thing, which people don't talk enough about. सिर्फ नहीं, दिन भर इतने सारे thoughts आए होते हैं, जो हमने push किए होते हैं. Things which have disturbed us, and we pay no attention to it. We're like, ciao. They all come back at night together, right? They're like, oh, तुमने इसको पैसे दिए क्या? तुमने इसको ऐसे क्यों बोला था? उसने तुम्हें ऐसे क्यों कहा? उसके साथ ये बात की थी कि नहीं? So all your thoughts are also coming back at night, right? So did you do some kind of self-work in the day? Did you dump those thoughts? Did you think of those thoughts consciously or not? अब solution भी इधर ही हो गया. First, stop looking at your clock, क्योंकि ये मेरा personal experience मैं आपको बताती हूँ. I have a little one. There are times when I wake up in the middle of the night, the baby calls us to her room. और अगर मैं घड़ी देख लूँ, then I start thinking, why is she awake at this time? Oh, खाना कम खाया था क्या? Why am I awake at this time? अब मुझे नींद आएगी कि नहीं? Before a flight, people have a lot of sleep anxiety, right? Because they keep checking their clock. So please, no clocks in bed, number 1. Number 2, in an ideal world, no devices 1 hour before. In a less ideal world, I am a very realistic person. मुझे नहीं लगता हम ideal जिंदगी जीते हैं. सोने से 5-7 मिनट 10 मिनट पहले तो रख दो, right? Third, and one of my favorite things is to do a guided breathing or an unguided breathing. And there's a term which we teach a lot of people. We teach the entire exercise protocol to people who suffer from sleep issues. अगर आप fancy terms में सोचेंगे तो उसको योगा निद्रा कहते हैं. अगर उसको psychological terms में बोलना चाहते हैं तो उसको कहते हैं JPMR, Jacobson's Progressive Muscular Relaxation. हर मस्कुलर ग्रुप को धीरे 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 रिलैक्स करना along with focus breathing. कोई भी type of breathing is also great. There's another fun technique. आपको याद है कहते थे count sheep, right? It works for some people and it doesn't work for some people, and it's perfectly fine. But there's another technique in which you can think of a object and start thinking of various characteristics of that object. Especially अगर आपको कोई thought आ रहा है जो आपको नहीं पसंद आ रहा है, right? So you cognitively take that. मान लीजिए मैंने लिख लिया balloon. Now I start thinking, oh, the balloon is red. Oh, B for ball. Okay, balls are like this. So it's a nice fun way to keep yourself engaged. May work for some, may not work for some. And I do like this thing that I do, especially at night. जब ज़्यादा थकी हुई होती हूँ और भी ज़्यादा अच्छा लगता है. I take a warm shower and then I get into the bed. सर गीला करने की ज़रूरत नहीं है. Just take a warm shower, get into the bed. रूम अगर आपका ठंडा है थोड़ा सा. So as the body is getting cooler, sleep will come to you. And this I want to reiterate. Don't run behind sleep. It will run further away from you. Invite sleep इनसे अच्छा ठीक है जब आना है आ जाना.
Don't fight for it.
Don't fight with sleep. आप तो झगड़ा कर रहे हो, इधर आओ, इधर आओ. So that's why your sleep anxiety is worse. But sleep is honestly the major chunk of the presentation for a lot of mental health issues. तो मैं कहती हूँ sleep is the tip of the iceberg. जब भी कोई sleep issues लाता है, मैं कहती हूँ नहीं, नींद की गोली नहीं खानी है. That's not the way to go. Maybe if you need it, we'll talk about a medication which is the right medication, right? इसके नीचे क्या है? What's underneath the sleep issue? And then you open a Pandora's box and you see there's so much, right?
Doctor, what kind of sleep issue and for how long one is facing sleep problems should one approach an expert?
Right. If you're only having insomnia, sleeplessness, on specific occasions, जैसे कि फ्लाइट पकड़नी है, बड़ी प्रेजेंटेशन है, रोज तो प्रेजेंटेशन आई डोंट थिंक होगी, रोज तो फ्लाइट पायलट छोड़ के किसी की नहीं होगी, राइट, एंड एरोस्टिस की. इफ यू आर हैविंग इट ओनली ओकेजनली, बाय ऑल मीन्स यू आर ओके, प्लीज, इट्स फाइन. Please also know that it has a start and an end, right? If you're not able to sleep for many days at an end, at a stretch, or for at least 2-3 days in a week, for many months together, and it starts impairing your day-to-day functioning, and obviously it starts impacting your health in other ways. So you will know that, your skin will start to look dull. Your friends will say, kya hua? Cognitively, aapka brain foggy hoga. Now you know that I've tried everything. Ab I should speak to someone. Kabhi-kabhi kuch choti-choti tweaks is all that you need, right? And you need to hear it from the doctor. Ghar ki murgi dal barabar. Your husband may say the same thing. Mobile mat dekho. But a doctor saying it may have more emphasis. So then you must contemplate speaking with an expert.
Dr. Era, हमने एक बहुत interesting research की थी internally in Traya to understand psychological impact of hair loss on people. Interesting insight that came from the study was that the impact that hair loss has on psychology or mental health was directly proportional to how younger the person is. So the graph was like, 25-year-old to let's say 65-year-old, and the response was like this, which means that for a 25-year-old guy, it was depression, suicidal thoughts, self-worth getting affected, and that sort of sobered down as the age increased. I really want to understand from you, what can one do if something like a condition is affecting them, for example, hair loss.
Why do we care so much about hair loss, and why do younger people care more is what you're asking, first of all, right? Our hair is a very big part of our body image and identity, right? हम जब छोटे होते हैं, हम drawing बनाते हैं, तो बच्चे बाल कैसे बनाते हैं, they actually observe a lot, right? How is the hair? Hair is a very big part of our confidence for most of us. Now, young people have more desire to be desirable, which is why they care more about looks. Nothing shallow about it. It's very, very normal. As age progresses, a lot of people make acceptance with the fact that it's okay, this is how my hair is, right? Now, coming to the second aspect, why care and how to basically manage acceptance or the emotions around something like hair loss. Please know that, sorry, but you are not just your hair. People over-define themselves with one physical attribute. तो कुछ लोग कहते हैं कि मेरा weight ज़्यादा है and I am so and so because of my weight. Hair is a very big important part. Work on it. But अगर आप ज़्यादा stress लगेंगे तो hair fall ज़्यादा होगा. In no way is it going to come down, right? And you must have also seen with your clients that frustration and that hurry कि कब ठीक होगा leads to far worse results than those who are patient and work on acceptance. So, acceptance is a very beautiful concept that we work on. Acceptance doesn't mean to not want to change. मैं करूँगी मेरे hair की treatment by all means. But I will also accept that if I'm थोड़ा सा भी better, this is one up. People go one up and they complain, why am I not here? So setting expectations, having acceptance,
and having a positive attitude towards improving.
True. Acceptance से positive aspect आ जाता है, right? Because we are like looking up. We're not looking down constantly. So yes, you are not just one body part, you're not just one attribute of you, but at the same time, keep working on it. Reduce your cortisol, reduce your stress around that one thing. लोग कहते हैं अरे this is a very common postpartum issue you must have observed, right? New mommies come with hair loss a lot, and they go to my dermatologist friends, and there's a entire area of psychodermatology जहाँ पे psychiatry and dermatology साथ में मिलती हैं. So these friends send me patients that have acne जो better ही नहीं हो रही है, hair loss जो better ही नहीं हो रहा है, all the treatment has been done. Yeah, for that matter, there is something called trichotillomania, in which a person just as an impulse pulls out hair from different parts of their body. Men can pull it out from their beard as well. And it is so harrowing for them because it comes with so much shame and disgust. और लोग आसपास कहते हैं क्यों कर रहा है, क्यों कर रही है, right? So when such people come, such patients come, we recognize that hair is such a big challenge. बहुत सारे लोग कहते हैं सब कुछ दिया भगवान ने, बस एक बाल अच्छे नहीं दिए हैं, right? So we have to work on the mindset. We have to work on working on ourselves, but also change the aspects.
Doctor, I was reading that WHO ने बताया कि कोविड के टाइम there was a rise in depression by 25%. And I know so many people जो आज भी something happened during COVID, they lost a family member, etc. उससे affected है. ट्रॉमा एक ऐसी चीज़ है जो कभी कभार ऐसी कोई चीज़ हमारी लाइफ में हो जाती है कि वो it can sometimes affect us for years. I really want to understand from you what is trauma and what are the different things that one should know in understanding a life event or something big that they feel has affected them.
Absolutely. And you're right about COVID. It became such a horrible time for all of us. But if I were to say something about mental health during COVID times, fortunately or unfortunately, I don't know how to paint this, people became more aware about mental health. You know why? Because it was a shared experience. You are suffering, I am suffering, we're all suffering. I saw a stark rise in acceptability around diagnosis around that time. Yes, I can understand. This is why there's depression. That's not how it works. ज़रूरी नहीं है trauma होना depression के लिए, but it was just an easier concept for people to grasp.
शायद थोड़ा स्टिग्मा भी कम हो गया उस टाइम पे क्योंकि ओपनली बात चल रही थी, कंटेंट ज्यादा कंज्यूम हो रहा था.
जी, you're right.
I think, and also openness to online consult during that time. I think COVID gave that to people कि भाई it's okay, आप किसी से बात कर लो online.
I have been working online since the pandemic. I don't think I'm ever going back. And yes, I'm able to help people who live in tier 2, tier 3 cities. Not only people in metros, because most of the mental health services are sadly flocking in metros. This is a big problem, right? So there is a lot of people who can now reach out for help. Coming to your second part, yes, trauma is one of those topics that we have started acknowledging, started talking about. There's a wonderful book called The Body Keeps Score. And this gentleman talks so beautifully that trauma आपकी body में भी रह जाता है. So, something traumatic that may have happened with you will stay back in your body, maybe in aches and pains, maybe in difficulty in maybe a part of body that was affected by the trauma. But what is trauma? Because trauma is such a commonly thrown around word also, right? I do not like the overuse of people saying, अरे यार मेरी favorite team हार गई, इतना trauma हो गया. यार उसने he stood me up यार, what a trauma. Yes, we can all have traumatic experiences, but in the psychological parlance, trauma is a very severe, catastrophic or repetitive over a long period of time kind of situation for a PTSD or a CPTSD diagnosis. I'll describe what that is. That is post-traumatic stress disorder and complex post-traumatic stress disorder. So trauma by definition needs to be of a bigger magnitude than कि मेरा pen नहीं मिल रहा. So clearly that is one step. At the same time, क्या होता है ब्रेन को ट्रॉमा में? I'll tell you a very interesting case of mine. This young person, no names of course, went through abuse. And she was eating strawberries at that time as a young person, as a even younger kid. And in adulthood, she went to a strawberry farm kind of thing, जैसे होता है यहाँ पे महाबलेश्वर की तरफ. And she just completely lost her memory for the next few days. And it was after a very long time कि याद आया कि strawberries खाई थी और फिर मेरे साथ assault हुआ था. The strawberries got the trigger. Now you'd say how? It's because smells, emotions, flashbacks, memories of traumatic experiences like natural disaster, rape, for that matter, a major car accident, riots, COVID, जहाँ पे इतना difficult था hospital find करना. Yeah, even something as traumatic as a very bad breakup or being physically hurt, domestic abuse, all of these get stored in your brain and your hippocampus remembers. अब उसके साइड पे है amygdala जो आपका इमोशनल सेंटर है. अब मान लीजिए कोई स्मेल आई या कोई विजुअल आया जैसे स्ट्रॉबेरीज मैं आपको बता रही थी. ब्रेन कहेगा ओ where do we remember this from? So either your olfactory center or your visual center says ये कहाँ पे पहले देखा था सुनो तो याद तो करो. So it pulls out that files and says oh it was not a nice time. चलो चलो forget about it. And what does it do? Dissociate. So you may have heard of the term called dissociation. Where people say that I felt मैं यहाँ खड़ा था पर मैं यहाँ बाहर अपने आप को खुद को देख रहा था. It's called depersonalization. I was so disconnected from the surroundings. Derealization. Some people have dissociative identity disorder. Many multiple identities. Some people have dissociative amnesia. भूल जाते हैं वो कौन थे, आप कौन हो, मैं आपको जानती नहीं हूँ. Some people have a seizure dissociative. So the brain and the body do keep the score of the emotions. And trauma is very complex. It does affect your brain. आजकल हम fMRI studies कर सकते हैं. They're basically MRI का भी एक higher degree functional magnetic resonance imaging. अगर वो ही traumatic incidents उनको बताया जाए, same parts of the brain will get activated that had when that trauma was happening.
Wow, so it does affect the brain.
Yes.
Even after years.
Oh yes. Doesn't forget. It remembers, it's sensitive to it, it's constantly on a guard, hypervigilance होती है. हर चीज़ में ऐसा लगता है that oh my god, somebody's going to touch me, कोई मुझे कुछ करने वाला है. If somebody's been through physical or some kind of sexual assault, right? There is nightmares, there is intense disconnect, and सारी relationships suffer करती हैं, काम suffer करता है, सब कुछ suffer करता है, of course. So trauma is genuine, but let's not use trauma very lightly. इतना सुनने के बाद I hope people will change their mindset to not call small things as trauma. Again, small शायद मैं बोल रही हूँ आपको ना लगे. If I'm scared of dogs, a dog barking for me is also traumatic. I get it. But let's not compare it to what some people have gone through. It trivializes their experience, no?
I think, Doctor, सबसे common, especially we were talking about teenagers and young Indians facing mental health issues, is a bad relationship.
Yeah.
Trauma. I don't know if I should, but bad relation affecting them.
Sure.
What is your opinion to really handling if somebody is going through this?
A lot of people come to me and they tell me that मेरा ex narcissist था. Now, again, we are so easy to jump to these jargons ना, कुछ ज़्यादा ही हो गया है. पहले वो crazy पागल label था, अब narcissist और you're such a hypochondriac and you're such a depressed soul. ये सारी चीज़ें हो गई हैं, right? हर जन narcissist नहीं है. The relationship could have been with a person who may have narcissistic personality traits or disorder. फर्क है. जैसे मैं पूरे टाइम बोलती आ रही हूँ कि डिग्रीज मैटर, राइट? कितना डिस्ट्रेस है. सिमिलरली पर्सनैलिटी डिसऑर्डर डायग्नोज करने के लिए बहुत सारे लोग मुझे ना कन्विंस करना चाहते हैं कि उनका एक्स नार्सिसिस्ट था. सो आई जस्ट स्माइल एंड आई से बट आई हैव नेवर टॉक टू देम. हाउ कैन आई गिव अ डायग्नोसिस कि उसकी बॉडी में उसके माइंड में क्या चल रहा है जब मैंने उन्हीं से बात नहीं की है. Sure, if I speak with them, maybe I can come to the same diagnosis. But they'll always say कि नहीं, my partner I live with is a total narcissist. So I always say, let's talk to them. Let's invite them in. Let me make my understanding around it. Is it sometimes a way to shift blame? Maybe. But yes, people do live with individuals who have a proper narcissistic personality disorder diagnosis. Again, it'll be wrong to just give 3-4 pointers and say ki how to know that you're living with a narcissist. It's a very catchy phrase, na? 5 steps to knowing whether I am with a narcissist or not. How come there's never an article 5 steps to knowing whether I am a narcissist or not? That's my feedback always. I'm like, हमने कभी सोचा है हम narcissist हैं कि नहीं? So narcissist is not a bad term. Narcissist is behind this mythological figure, okay? He was in love with his own reflection. वो अपने आप को पानी में देख के खुद को निहारता रहता था. तो it was said कि जब somebody is in love with themselves is called narcissism. That is how the term was coined. But Narcissus, his name was. But over the period of time, ये देखा गया है that personalities अलग-अलग टाइप की होती हैं. So we in scientific terms have cluster A, cluster B, cluster C. Cluster A छोड़ देते हैं फिलहाल. क्लस्टर बी के बारे में बात करते हैं, जहाँ पे एंटी सोशल पर्सनैलिटी डिसऑर्डर, पर्टिकुलरली जो लोग बहुत ज़्यादा दंगा करते हैं, जेल में चले जाते हैं, दे हैव अ ट्रस्ट विद द क्राइम एंड लॉ एसेंशियली इन अ नटशेल. नार्सिसिस्टिक पर्सनैलिटी डिसऑर्डर, पीपल हु आर ऑल अबाउट मी, माई सेल्फ, मैं, वो कभी गलत ही नहीं होते. दे नेवर अग्री टू द फैक्ट दैट दे कैन मेक अ मिस्टेक. एट द सेम टाइम they have a grand sense of entitlement. How dare you make me wait in line for the for check-in? I'm here first all the time, not sometimes, right? Similarly, they have inferiority complex disguised as superiority complex. There's a lot of jealousy. Mind you, inferiority disguises superiority, and jealousy की उसको कैसे चांस मिल गया, मेरे को नहीं मिला. Again, don't just think because you have jealousy. Jealousy is a normal emotion all over, right? इसके साथ साथ आपके एक्शंस और इनएक्शन से आपके आसपास वाले लोगों को फर्क पड़ रहा है. It is impacting other people. That is a very important hallmark of personality disorders. Next is borderline personality disorder. Another common disorder where there is a lot of lability of emotions. Too hot, too cold. बहुत ज़्यादा जिसको कहते हैं मूड स्विंग्स लोग कॉमन पार्लेंस में, बहुत ज़्यादा फियर ऑफ अबैंडनमेंट होना, मेरा पार्टनर मुझे छोड़ जाएगा. दे आर यूजुअली वेरी एंशियस टेक्स्टर्स, दे विल बी लाइक मुझसे बात करो, राइट? एंड देन देयर इज अ हिस्ट्रॉनिक पर्सनैलिटी. तो अगेन इट्स वेरी इजी टू यूज दीज टर्म्स. It takes years to learn to diagnose them. You can't diagnose somebody in one go. I never diagnose in one go. I give people a fair 2-3. I obviously have my notes from day one, but 2-3 बार के बाद I'm like, okay, let's now look at this. Let's get a psychological test. Let's be very, very sure. So, if you are in a relationship and you are a young person, here's my advice. Do a lot of self-work. Don't get all your meaning from your partner. क्योंकि जब आप उनको अपना ऑक्सीजन बना लोगे ना, तो if they leave, then you will struggle. Make sure you are still friends with a lot of other friends, right? This person needs to not be the center of your universe. They need to be important planet in your universe. You are the sun and the moon of your own universe. So that's my humble request to people in relationship, especially if this is your first relationship, or even if it's your 10th for that matter. Relationships need to be between two people who treat each other with respect and love, not when the dynamics are skewed.
Doctor, I've heard about this term emotionally strong. Please help us understand this more and how to become one.
But for that, first we need to understand what are emotions. हमें emotions ही नहीं पता है, right? अगर मैं किसी से पूछती हूँ, hi, how are you feeling? Like good or bad. But emotions are not good and bad. Emotions, एक तो first of all, they are the psychological and the physiological response we have to a situation. What were my emotions when we started talking? What are my emotions now? So every few minutes also I can check in on my emotions. But अपने emotions समझना पहले बहुत important काम है. So emotions primarily देखा जाए तो I think Inside Out has beautifully explained it. Happy, sad, shame, disgust, guilt, all of these are emotions. हम guilt को भी bad emotion नहीं मानते हैं. अगर मैंने आपका कप तोड़ दिया and I'll feel guilty, it's a valid emotion. So first we need to teach our children emotions when they are young rather than saying good and bad for everything. Now comes the part how to be emotionally strong. For that again, what is physically strong? Do you call a person who can bench press 100 kg physically strong, or do you call a person who can do a yoga pose like a pro physically strong, or do you call a marathoner physically strong, or do you call mothers physically strong because they push out a baby? So again, physical strength can be varied. Similarly, emotional strength can be varied. Broadly speaking, emotional strength मतलब आपकी coping skills अच्छा होना, क्योंकि स्ट्रेस हमेशा है, स्ट्रेस हमेशा आएगा. लेट्स नॉट रन अवे फ्रॉम स्ट्रेस. स्ट्रेस अच्छा भी होता है कभी कभी. सेकेंड, आप कितने इमोशनली रेजिलिएंट हैं. अनदर थिंग इज आप कितने अपने इमोशंस पे कंट्रोल, नहीं बोलना चाहूंगी, कंट्रोल इज गॉट अ वेरी नेगेटिव कॉनोटेशन. आप कितने अपने इमोशंस को समझ सकते हैं और उसको ठहराव से या तो उस समय एक्सप्रेस कर सकते हैं या बाद में एक्सप्रेस कर सकते हैं. सो कितना नियंत्रण, कितना एक तरह से अगेन नियंत्रण ट्रांसलेट्स टू कंट्रोल, बट कितना आपके अंदर इतना ठहराव है कि आप अपने इमोशंस के साथ बात कर सकते हैं. लेट्स पुट इट लाइक दैट. नाउ हाउ टू गेट देयर, हाउ डू आई बिकम मोर इमोशनली रेजिलिएंट, हाउ डू आई बिकम दैट इन अ वे कि मुझे कभी बुरा ना लगे, कि मुझे कभी कोई कुछ बोल भी जाए तब भी कुछ भी ना हो. ऐसा नहीं हो सकता है. आई एम अ साइकियाट्रिस्ट, आई टीच दिस फॉर अ लिविंग. मुझे भी बुरा लगता है दिन में बहुत बारी. देयर आर टाइम्स आई गेट एंग्री, देयर आर टाइम्स आई एम सैड, there are times I'm super happy.
Have you ever taken therapy?
Absolutely. I would be a hypocrite for saying कि everybody should take care of their mental health and I will not. मेरे को भगवान जी ने अवतार नहीं दिया है that you're a psychiatrist so you don't need mental health help. I am not better than the people I help. In fact, I get better with every person I help. Very humbly. When people tell me thank you doctor, I say thank you. Because you trusted me and we are here now. So in no way am I a superhero who can do it all, be it all. नहीं, सारी awareness होने के बावजूद आप realize करिए there is a mole on your back that you can't see. And that's why therapy comes to the rescue. So I started going to therapy 7-8 years ago when I had a situation where there was a lot of anxiety involved around it. And I could realize it was more than normal. And I did go to a psychiatrist also, and I did go to a therapist also, a psychologist also. And I did realize that this is something I should do often. वही ना, पहले इतनी बड़ी बड़ी बातें कर रहे हो, you're preaching, but you're not doing it yourself. A dentist not brushing their teeth twice a day नहीं जमता है. And let me tell you what therapy has done for me. Yes, it has made me emotionally better, emotionally aware. It has made me more empathetic for the patients. Every time I sit on that side of the couch, I realize how humbling this experience is. And it has given me accountability to give to someone. Because काफी बारी हम खुद को बहुत कुछ promise करते हैं, नहीं करते हैं, right? So how to be emotionally resilient? You do not have to do everything that I say. Please, you do you. सबका अपना तरीका होता है. आपको चावल पसंद है कि रोटी, you decide. But जैसे ब्रॉडली एक डाइट में एक्सप्लेन किया जाता है ना कि कार्बोहाइड्रेट्स खाओ, प्रोटीन्स खाओ, फैट्स खाओ. आपको इमोशनली रेजिलिएंट रहने के लिए यू नीड टू फाइंड वेज, लाइक आई टॉक्ड अबाउट द साइकोलॉजिकल टूल किट, कि ये 5-6 पिलर्स मैं अपने कंट्रोल में रखना चाहूंगा इन अ गुड वे. इसके अलावा यस, आई विल नॉट बी इन डिनायल कि मुझे मदद की जरूरत है. मे बी आई विल गो टू थेरेपी. Maybe I will vent to a loved one. Maybe I will journal about it. Maybe I will start practicing gratitude. क्योंकि रोज करी हुई practice हमेशा leads to leaps and bounds. Some people do positive affirmations regularly. Some people chant regularly. पूजा भी बहुत ही ज़्यादा help करती है कुछ लोगों को. Similarly, your body can be taught many things to be emotionally resilient. तो अगर सामने शेर आ जाए अभी, आप क्या करोगे?
या तो फ्रीज या तो दौड़ना.
राइट. बट वो भी एक प्रैक्टिस होती है दैट वी टीच आवर बॉडी व्हाट टू रिस्पॉन्ड विद. अगर किसी ने हमें गाली दी, हम क्या करते हैं? मोस्ट ऑफ अस लैश बैक विदाउट रियलाइजिंग वो गाली मुझे नहीं, पीछे वाले को दी थी. राइट. So these are all practices. You can play along with your body. You can do a lot of breathing for grounding. You can journal how somebody made you feel or how you felt when you did something. ये सारे तरीके लाइफ लॉन्ग करने हैं, तभी इमोशनली रेजिलिएंट होगे. एंड इवन अ फिजिकली स्ट्रॉन्ग पर्सन कैन गेट इंजर्ड. So even an emotionally resilient and strong person can have mental health issues despite all of this.
Superb. Doctor, I want to move to the next segment of our conversation, which is, we call it the myth busting. Well, that's why we started What the Health, to have you here and really help us understand kya myth hai, kya nahi. I think most of our conversation was really eye-opening, but would want to go through this segment.
Absolutely.
The first one, procrastination is nothing but laziness.
Myth. Procrastination is fear to finish a task because you're worried about the outcome. Procrastination is boredom sometimes. And procrastination is everything else but laziness.
Interesting. People with mental health conditions are violent.
Absolutely wrong. Completely a myth. Quite the contrary. Would you be surprised to hear that sometimes caregivers of people with mental health issues are violent towards them? Number one. Number two, this myth is propagated because of cinema's portrayal of mental health. And number three, yes, patients with mental health disorders sometimes feel suspicious and they act out on hallucinations is when they may be violent, but they have no intention of hurting you. So, no, myth.
Strict parenting makes punctual babies.
Ouch. Strict parenting makes children who become extremely anal and uptight and, yes, punctual, if you want to call that a good trait, but they also lead to children with resentment, and sometimes they can just feel like defiant कि मैं क्यों करूं सब कुछ time पे. So it can be either or.
Modern work culture is promoting self-sabotaging behavior in employees by extra work hours.
Yes and no. This has always been the case. Toxic productivity has always been the poster child for people to feel मैं बहुत इंपॉर्टेंट हूँ, मैं 24 घंटा काम करता हूँ. आई एम सो इम्पॉर्टेंट टू माई ऑर्गेनाइजेशन, मेरे बिना तो काम ही नहीं होगा. सो टॉक्सिक प्रोडक्टिविटी वॉज ऑल्सो द टूल ऑफ आवर पेरेंट्स एंड द जनरेशन अबव कि बेटा बस काम करो, काम ही इंपॉर्टेंट है. सो आई वुड से वी आर नो बेटर, बट या दिस इज आवर कल्चर.
People with strong support systems don't need therapy.
Okay. People with strong support system who truly empathize with them and can understand them may need therapy much lesser than other people without the strong support system. But sometimes the support system itself is the reason for the problem. So you have to evaluate, क्योंकि just because आपके अच्छे दोस्त हैं but वो therapist नहीं हो सकते हैं. So I'll stay on the fence on this one and say yes, maybe.
Children don't experience mental health issues.
They have the most issues. They don't voice it क्योंकि उनको शब्द नहीं पता है क्या बोलना है, और हम लोगों ने प्रिज्यूम किया हुआ है कि उनको कोई प्रॉब्लम नहीं है.
कौन सी एज से बच्चों को mental health issues हो सकता है?
I've seen children, first of all, autism can be detected fairly early. So 3-4 साल के बच्चों को autism मैंने खुद डायग्नोज किया हुआ है. We've diagnosed ADHD fairly early. Bipolar disorder below 10 years. OCD, very common, young children, 6, 7, 8. Depression, super common, not diagnosed. Bedwetting के फॉर्मेट में काफ़ी बारी दिखता है. अब ज़रूरी नहीं है कि हर बच्चे को bedwetting की वजह से डिप्रेशन एंजाइटी का डायग्नोसिस है, बट चिल्ड्रन हैव स्कूल रिफ्यूजल, चिल्ड्रन हैव सेपरेशन एंजाइटी. सो चिल्ड्रन हैव देयर ओन वे ऑफ प्रेजेंटिंग. तो काफ़ी यंग एज से स्टार्ट हो सकता है.
People with mental health disorders should stay at home and not participate in work or any social activity.
फिर तो सारी दुनिया ही बंद हो जाएगी. You know, some of my patients are doctors, lawyers, teachers, entrepreneurs, politicians, actors, mental health professionals themselves. So if you have a mind, you can have a mental health issue. So in fact, you can be very valuable and you can work on yourself, and no organization can refuse you work. Please know that. A lot of people are scared कि मेरी organization में पता चल जाएगा तो मुझे निकाल देंगे. Absolutely not true.
People with neurological and psychological issues should not have kids.
But then half the world's population would be wiped out. Also, if I may understand, what if somebody gets a psychological or neurological disorder after having kids?
Yeah.
Possible, right? There are certain conditions which neurologically especially where genetic markers are involved, जहाँ पे हम parents को बताते हैं कि what are the chances of the child having the said condition. But again, इवन अगर स्किज़ोफ्रेनिया 2 पेरेंट्स को हो तो द परसेंटेज चांसेस ऑफ द child having it is higher than obviously the average population. Doesn't mean that they should not have children. It's a choice that only a couple should make with some medical relevant information involved.
Doctor, I would like to move to the next segment. I have received some questions from our community where people are asking questions to you. We told them that you are going to be here. So I'll start with the question and would need
Sure.
you to answer them. Hi, my name is Seema. I'm 28 years old. Doctor Era, everyone talks about therapy, but it can be expensive for a lot of us. That's right.
Absolutely.
For those who can't afford it, how can we take care of our mental health well-being?
Hi Seema, great question, relevant question. मगर पहले मैं बताना चाहती हूँ कि यूएस में थेरेपी कितना कॉस्ट करता है और इंडिया में कितना करता है. Any guesses? So an average session in US would cost anywhere between $250 to maybe $2,500. अब कम भी हो सकता है, $50 में भी होगी, बट $50 भी हमारे लिए बहुत है, राइट? An average session for therapy 55 to 60 minutes होती है थेरेपी, 10 मिनट नहीं होती है. An average doctor consult with due respect is not longer than 10 to 15 minutes. अगर आप अपनी हड्डी दिखाने चाहते हैं, अगर आप अपनी आंख दिखाने चाहते हैं, अगर आप अपना बुखार दिखाने चाहते हैं, 10 से 15 मिनट की ही कंसल्टेशन बनती है. तो आप खुद ही सोचिए, 55 से 60 मिनट, 45 से 60 मिनट पकड़ लीजिए. In India would cost anywhere between 400 to maybe 5,000. Obviously इससे कम ज़्यादा हो सकता है. कहाँ पे आप ले रहे हैं, कितना एक्सपीरियंस है, कौन है, साइकियाट्रिस्ट हैं, साइकोलॉजिस्ट हैं, क्लिनिकल हैं, काउंसलिंग है, बहुत सारे फैक्टर्स मैटर करते हैं. बट व्हाट इफ आई टोल्ड यू कि मुफ्त में भी थेरेपी मिलती है?
मुफ्त में कहाँ मिलेगी?
सो दैट्स द पार्ट. पीपल से रिसोर्सेज नहीं हैं, मगर दे फॉरगेट government hospitals do have psychological support. I used to work in a government hospital and definitely line लगानी पड़ती है, but that doesn't change the fact that हम लोगों ने वहीं पे काम किया है, वहीं पे सीखा है. So free resources exist. Number one, government hospital. Find one near you. They will take care of it. They're supposed to, right? The government pays them. Number two, Telemanas is a new helpline which has been launched. अगर आप क्राइसिस में हैं और बेसिक काउंसलिंग के लिए वो ज़रूर आपको नियरेस्ट जगह पे कनेक्ट कर देते हैं, बट ऑनलाइन टेलीमानस की सपोर्ट आप कभी भी ले सकते हैं. दैट्स अनदर फ्री रिसोर्स फॉर यू. वेट, आई विल गिव यू मोर फ्री. ठीक है. देयर इज समथिंग कॉल्ड प्रो बोनो सेशंस. हम में से बहुत सारे लोग प्रो बोनो सेशंस लेते हैं. मैं खुद प्रो बोनो सेशंस लेती हूँ फॉर स्टूडेंट्स. हर महीने कुछ स्पेसिफिक स्लॉट्स रखती हूँ. ऑब्वियसली आई कांट कीप ऑल माई स्लॉट्स एम्प्टी फॉर दैट. Every month there are some pro bono sessions for either students, people with financial difficulties, or people who've lost a husband most likely, and the woman is supporting their family, you know, उनके financial इतना वो नहीं है. So unemployed कुछ young लोग हैं जिनको मैं मजाक से बोलती हूँ, जिस दिन कमाने लगोगे उस दिन से फीस पे करना स्टार्ट कर देना. And they do. That's the beauty. So check for pro bono sessions. हम लोग अच्छे लोग हैं, मदद करना चाहते हैं. एंड अनदर रिसोर्स इज स्लाइडिंग स्केल. स्लाइडिंग स्केल होता है स्पेशली जब थेरेपिस्ट नए सेशन स्टार्ट करते हैं, व्हेन दे आर जस्ट लर्निंग ऑन द रोप्स. वो एज यू पे गो मॉडल बना देते हैं. दे से ओके, यू कांट पे 1,000 रुपीज, कैन यू पे 500 रुपीज? इट्स ओके, मैं 500 अपनी जेब से भर लूंगी. बेसिकली आई एम गिविंग दैट एज अ 50% ऑफ टू यू. बट उनको क्या मिल रहा है? दे आर बेसिकली वर्किंग विद मोर क्लाइंट्स इन द बिगिनिंग, एक्सपीरियंस. सो कीप योर माइंड ओपन. मुफ्त में है अवेलेबल. बट कमिंग टू द फैक्ट, अगर मान लीजिए ये भी 5 ग्रेट एवेन्यूज जो मैंने आपको दिखाए नहीं वर्क करते हैं. Self-help books are helpful for some people, provided you read them and please execute them. Self-help books are not shelf-help books. That's important. इसी तरह से something like a grounding practice, breathing practice आप रेगुलरली करिए, ज़रूर फ़ायदा बनता है. जर्नलिंग, इंटरनेट भरा हुआ है जर्नल से. Find an app, find a prompted journal, start writing. You'll feel better, I promise. It's not the same as therapy, but it is very, very helpful. And even workbooks आती हैं थेरेपी की, जो कि हम भी रिसोर्सेज देते हैं, बट उसके लिए कुछ बेसिक समझाने पड़ते हैं, ऑफ कोर्स. बट इफ़ यू आर रिसोर्सफुल, गो फॉर इट. डू अ वर्कबुक, राइट? सो देर आर वेज. वेयर देयर इज अ विल, देयर इज अ वे. अगर आपको करना है अपनी मेंटल हेल्थ पे वर्क, तो कोई नहीं रोक सकता आपको.
I love the answer. I'll move to the next one, which is doctor, with so many breathing techniques floating around, please tell us what is the best way to breathe out the stress.
Out. The best way is to breathe normally the way we are. But I agree. इतनी सारी techniques आ गई हैं and हम इतने confused हो जाते हैं. I say learn one and practice it over and over again. It's more about practice, not the perfection. If I can teach the viewers maybe my favorite, couple of them, let's do it together. The first one is called the physiological sigh. It's founded in the principle कि हम पहले एक inhale करेंगे, सांस लेंगे. अब गलती कहाँ होती है मैं बताती हूँ. लोग जब सांस लेते हैं, अभी आप सांस ले रहे हैं, tell me what's happening to your stomach when you're inhaling, what's happening to your stomach when you're exhaling.
My stomach is expanding when I'm inhaling, and my stomach is going inside or contracting when I'm exhaling.
Excellent. A lot of people are doing it wrong. Would you believe it? They're contracting their stomach when they're inhaling.
breathing exercise.
आप करते हो, चलो आप प्रो हो, है ना?
नहीं.
But people at home, check, pause, check, right? So check your breathing. That's step one. Number two, let's take a physiological sigh. A physiological sigh is simply आप inhale करेंगे नाक से, पर एक और छोटी सी सांस और inhale करेंगे, and then sigh क्या होता है? Is a sigh, right? आपने देखा हम sigh कब करते हैं? जब we have a rahat, relief, absolutely. So this is extremely helpful, and all you need to do is breathe in through the nose. Do it a few times over. Another one is box breathing, very famous. Box breathing is equal inhale, equal exhale, and another inhale, another exhale. ऐसे डब्बे की तरह चलाते रहना. पर मेरा फेवरेट है just breathe in, observe, pause, breathe out, observe. Count करना है, count करिए. But breathing is one thing you take with you everywhere, and you can do it anytime. Lying down, standing, waiting in the line. Today I was waiting in the line and somebody wanted to cut the line and I said, जाइए आप. And I just kept my breathing on. I was like, okay, कितना late हो जाऊंगी मैं? 2 minute late हो जाऊंगी. Just only when you've probably eaten and you've had too much water, तब मत करिए अगर आपको पेट में discomfort होगा. But there is no perfect breathing. मत ढूंढो. एक ढूंढो, stick to it.
कुछ भी करो, करते रहो.
Exactly.
Dr. I'm Siddharth, 38 years old. It's been so long since I've completed my 10th board exam, but sometimes I still have those dreams. Where I'm failing the exam, sometimes getting late for the exam. Why is this happening to me after so many years?
Ouch, Siddharth. I think a lot of people will resonate with this. What are dreams? Now, Sigmund Freud has done a lot of work around it, right? We also call it the Royal Road to Unconscious. है ना? ड्रीम्स क्या हैं? सबसे पहले कोई इवेंट, दूसरी बात आपकी फिजियोलॉजी. आपने देखा है जब ब्लैडर भरा होता है, यूरिन करने का मन करता है तो नाइटमेयर्स आते हैं, राइट? अनाप शनाप से ड्रीम्स आते हैं. एंड तीसरा है आपकी सबकॉन्शियस में क्या भरा हुआ है. बिकॉज व्हेन यू आर स्लीपिंग यू आर नॉट रियली इन कंट्रोल, तो जो नीचे है वो ऊपर उठ के आ रहा है. क्लियरली आपका एग्जाम जितने नंबर आए थे वो आप मुझे बाद में बताएंगे, बट देयर वॉज अ लॉट ऑफ हाइटेंड एंजाइटी अराउंड दैट एक्सपीरियंस. इज इट पॉसिबल कि रोजमर्रा की जिंदगी में जहाँ पे परफॉर्मेंस आपको करनी पड़ रही है, नाउ दैट यू आर 38, वहाँ पे you go back to the fear of failure, which leads to the subconscious fear of failure, which leads you to have that similar dream. अब क्या करना चाहिए? वो ड्रीम को नहीं भगाना है, वो ड्रीम को समझना है, fear of failure पे काम करना है, and अपनी needs recognize करनी है that this experience meant something very important to me.
I think on that note, thank you so much, Doctor. I hope that हम सब realize करें. I think my big takeaway from this conversation is कि सबके साथ हो सकता है, and it's absolutely okay to go and take help. But there are things that we can do, just like we are doing for our health, for our fitness. Mental health और mental fitness तो और ज़्यादा ज़रूरी है. So I hope that we all build a psychological toolkit for ourselves. Try to do things to become emotionally stronger so that we can manage all the stress, manage all that life is throwing at us and handle it better.
Absolutely. That's what life is about. Try and, fail, get better, try again.